I'm Elizabeth Esty for the Emergency Medical Minute. Today is March 26th, and we'll be bringing you an interview with a Denver area emergency physician who fell ill with COVID-19 12 days ago. He's finally feeling better, and I think his reflections on his job, his illness, recovery, quarantine, and what it's like to live in a household where everyone has COVID will be of real interest to our listeners.
Hi there. So how are you feeling?
So I'm doing better, a little bit better the last couple of days. Finally feeling improved. I think today would be considered day 12 of my illness, and it's a day when I feel like I could finally get back to work. I'm not doing that yet. I'm not scheduled to work for a few more days, but this is the first day I felt like a normal person again.
First day in 12 days.
That's right.
And how did it go down? What did you first notice?
Sure. I mean, I should say, all of us who work in the emergency department have an awareness that we're on the front line. And we, just by way of perspective, we are an unbelievably healthy family, blessed to be so. I would say that between residency and working where I do currently, in 2 decades of practicing emergency medicine, I've never once missed a shift for illness. So that's our perspective. So going into this, I remember several weeks ago, my wife saying, "So you're going to get corona, you're going to get COVID." And I said, "Yeah, I will. I'll be exposed. I'm sure that I'll get sick." At the time, I was hopeful, based on, reports that I'd heard and read, that for some people it was simply like a, flu-like illness or like a bad cold. Maybe you felt unwell for a few days, and that was about it. Probably based on my past experience, I thought, well, surely that will be the worst for me. If I get anything at all, I'll, feel a little congested, a little run down for a few days, and that's about it. But I will say that was not my experience at all. It started with just the very slightest of cough, and I thought to myself, well, this may be it. Or at the very least, certainly I'm going to need to isolate myself and think carefully whether I can work or not. That happened to be going into a scheduled spring break for our family, so that I knew that I was going to be off for at least a week, and thought, well, this will be a time to recuperate. We had, again, probably overly optimistically seen the turmoil in the world, including airline prices, and jumped on some great bargains. We had optimistically made some plans to go to Cancun for spring break. And that would have been on a Monday evening. I became sick on a Sunday and really pulled the plug on travel just 24 hours before our planned trip. So Sunday evening, we canceled our Monday evening flight to Cancun. In retrospect, that was most certainly the right decision. And, I could have become famous for the foolish ER doctor who carried coronavirus down to Cancun.
Yeah. So you canceled. Did you cancel based on a slight cough, or at that point were you feeling something more?
Yeah, by Sunday evening, I was starting to have a lot of myalgias and chills within that first 24 hours. And those were the predominant symptoms for the first few days, I would say. Lots of headache, lots of myalgias, chills. Interestingly, never had a documented fever. I checked myself a couple of times, but not regularly, certainly not checking on a twice-a-day basis. And based on that, I decided to cancel our travel plans. But yeah, the fatigue and the muscle aches were almost like nothing I've experienced in the past. There was one day in particular that I think I took 7 separate naps, and that was on top of having slept 9+ hours the night before. So a lot of fatigue, and I did have little times, especially in the first days, where I felt well for a while. In fact, I went out and accomplished a lot of yard work, maybe for an hour, and then I'd have to, come back and sleep for 2 hours to recuperate from that.
So how many hours a day were you sleeping or in bed?
I mean, some of it was just choosing to be in bed with my, laptop or a book or whatever. But I would say sleeping hours on my worst days were probably 13 plus hours of sleep.
And was that real sleep, or was that tossing and turning like a malaria patient in a 1960s movie?
No, for me it was profound, deep sleep with strange dreams, which I should have written down, but did not. So can't really tell you what those were.
COVID dreams.
Yeah, exactly.
And you have a spouse and children. Were you isolating yourself from them, or were you guys resigned to everyone getting sick?
In the beginning, before I ever got sick, and even in the early days, I think my wife's attitude, a little bit like mine, having a very healthy background and perspective, was, bring it on. We'll just get this early and get it over with. Having said that, I did self-isolate. I mean, I had been taking extra precautions at work for the last few weeks, coming home and showering right away, or, immediately getting rid of my clothes or doing other things that would protect my family, but not overly worried. And then in those first few days when I got sick, I did self-isolate. My wife immediately switched to another bedroom, and we were pretty cautious about meals and just me staying away from the family in general. Once my wife became ill as well, we just figured the entire family had been exposed, and we might as well live life as normal, being together as we normally would.
Yeah. And what day of your illness did she start to feel sick?
It was about 2 days after I did. And then the kids followed by about a day or two, but their symptoms have really been quite mild compared to the two of us.
And for her, would you say the worst illness you've had in your life, or?
Yeah, I would say so. I know that I can say that for myself. Definitely the worst illness that I have ever experienced. And knowing her health history, I would probably say the same. She's had some other more routine things that I haven't experienced, like having her appendix out in childhood and things like that. But in general, has been a very healthy person. So probably her worst lifetime illness as well.
Was there any point in these 12 days where you felt so short of breath at all? I guess I haven't asked you. You had cough, myalgia, just incredible fatigue. Did you feel short of breath?
I haven't this entire time. My cough has been relatively sparse, and I have not felt dyspneic. Now, I'm a runner, and I haven't gone running for almost 2 weeks now, so I haven't stretched my physiology just yet. But I know that dyspnea has been a pretty prominent symptom for my wife, Heather. She has complained of that for several days in a row. As I observe her lying in bed, I can see at times that she's tachypnic and just doesn't feel well. We don't have a home pulse oximeter, so I have not checked to see what her O2 sats are. I did get out my stethoscope and listen to her a few times, and she seemed to sound okay. So we've just assumed that that's going to recover with time.
Yeah, and she's 2 days behind you, I believe you said.
That's right. And I would say even now, again, today I feel almost normal, and she's still very wiped out and lying around napping a lot.
Yeah. I'm so sorry. What an ordeal. And the kids are fine, more or less fine.
Yeah, the kids are pretty good. Our two youngest at home, who are currently 16 and 13, had maybe 2 days of just being a little extra sleepy and a little bit of headache. I think they would describe it as like having a cold. And then our older son at home is 18. He lagged their symptoms by a couple of days, and his symptoms are similar, but rather than 2 days, maybe lingering for 3 or 4 days. Now, interestingly, we had a son who was doing missionary work in Thailand and just spent an entire month indoors in quarantine and was finally sent home to avoid the coronavirus, only to come to our household and definitely get exposed.
Oh, that's excellent. So you're all home.
We're all home now.
You're all sick, and in a few days you'll all be well.
That's right, and we'll feel indestructible and ready to go help others.
Yeah, and that is a thought I've had is, you are early adopters and sort of have a bit of a superpower now. I mean, I don't think we know yet what the immunity how long the immunity to this virus lasts, but you've got certainly a few months, maybe more like years of immunity, which does give you sort of a special power. How are you feeling about going back to work with that? With those antibodies in you.
Right. I've joked with several people that my serum will be available for purchase later on. I feel good. Certainly, I will continue to be careful and continue to follow all of the PPE precautions that we are at work. But now, with the feeling being that it's a little bit less about my own personal protection and almost entirely now about patient protection and spreading between patient contacts that I might have. So I will say, again, while the science is early and we don't know exactly what kind of immunity this might confer, I move forward with some degree of confidence, whether it's going to the grocery store or just being in the work environment, that I'm going to be okay, even if I'm around someone who's sick. So that's a really nice feeling.
Yeah. I don't remember, I read in the last few days some article or someone proposing that people who are immune should have a special colored wristband or some identifying marker, and you would be the first around here, I assume.
Yeah.
To go out, maybe a tattoo or some sort of
special
haircut, a special haircut for you.
Right.
A couple offbeat questions for you. When you were sick, as some of the first Coloradans, to have tested positive, did you feel a need to hide your illness or not disclose to your friends, families, neighbors? Did you have any sense of COVID stigma or wanting to keep this private?
I did not. I will say there are just a few individuals in our lives that we were a little hesitant to let them know for fear that they would worry excessively, which included my own mother, of course. That's what mothers are best at, is worrying about you. And I have been very open with my family, and they've been very supportive from afar. And just today, I got an Amazon shipment of Gatorade from my sister, which is perhaps too little, too late, but I can use it when I get back to running.
For sure.
There are some other people in our lives who are just, they're worriers. We all know people like that. And if I'd been around them within the last couple of weeks, I know that would be a cause of concern for them. So we weren't necessarily trumpeting the news to those individuals. But no, we felt free to share. One frustrating aspect, of course, was that the test took about 5 days to come back. Now, I should be grateful simply that I had easy access to a test as a healthcare worker, because I know a lot of people have been frustrated. For me, it was a really simple process. Once I let our group know that I was sick, they arranged with employee health, and I just had to drive up to the hospital. Someone swooped out in a gown and gave me an incredibly painful nasal swab, and that was it. So the testing was very easy, and I was lucky in that regard. But I also knew during those 5 days that for our non-medical friends, it was like their response to my illness was hinging upon a positive or negative test, whereas I knew based on what I was experiencing personally that it had to be COVID. I mean, I just never experienced anything like that, and with the whole family becoming ill, I just knew it couldn't be anything else.
Yeah.
But that is an interesting aspect. I mean, we know the test is not perfect. I think sensitivity best numbers are somewhere in the 65 to 70% sensitive range. So that was kind of a weird waiting period where I was really sick, but half the people in my life finally believed it 5 days in when I got the test done.
Then the real sympathy came.
Yeah, exactly.
And I'm just curious about the psychology of experiencing an illness like this, just knowing that this is a virus that's new to the planet. Were there moments of worry that were atypical for you, or anything about your thinking about this virus that was different?
Again, having always been healthy, I was probably overconfident that I was going to be fine, ultimately, in the end. I mean, I never worried long-term for my health or safety, nor for the health and safety of my family. I always assumed that we were going to get through this without complication. Having said that, it did at some point, finally wear through my patience and endurance. I mean, when you're initially sick, you feel lousy and you think this too shall pass. But when you're 9-10 days into it not passing and you feel just as bad or worse than you did on day one, it is mentally taxing for sure.
Mm-hmm.
I was just so ready to be done. So I'm grateful to have finally turned the corner.
Yeah, well, we're grateful and so glad that you're feeling better. Do you have any yard work? Seems to be one of the things you did. Or any advice for people suffering those 10 days on just things that made it easier for you? Or
I'm not a person who takes medication very often. I don't take any prescription medications. I would say in my normal life, there might be literally twice a year that I would take an ibuprofen after turning an ankle on a trail run or something like
mm-hmm.
that. So when you don't take meds like that and then you start to sample Tylenol and ibuprofen, it's incredible. I mean, the difference that, and I was doing relatively low doses, 350 of Tylenol, 400 of ibuprofen,
mm-hmm.
and it was amazing. For a period of a few hours, it would have me feeling almost normal.
So 20 years into your career as a physician, you discovered that Tylenol and said they're effective.
Yeah, well, I always knew, and I recommend them to patients, certainly, but I just don't have a lot of need for them personally in my life.
Right.
But they have been the wonder drugs in this last little while for me.
Yeah, well, good.
And that, one thing I guess we didn't touch on was fever. That might be interesting for some people. Early on, I know even our screening protocols at the hospital were there's got to be fever. And in fact, my first symptoms were without fever, and the initial recommendation for me was not to get tested. And I would say I did not have any fever until about day 6.
Wow.
And then I had recurrent fever, several days in a row. And that was around, I think the highest. It's a temporal thermometer, so I don't always believe the numbers. There was one that was up to 103 something, but I think generally I was in 101 to 102 range. But yeah, many days with just really mostly mild, just headaches and fatigue and no documented fever. So again, I know early in this process, we weren't even really screening people unless they had fever. And my experience was that I just didn't have it early on.
Yeah. I have to ask you because we did a podcast yesterday on anosmia and COVID. Did you lose your sense of smell?
I don't think so. I guess I should go test some things. My exceptionally poor sense of smell could hardly get any worse. So nothing that I've noticed, but I haven't been around anything pungent, and I don't have a very good nose as it is.
Yeah. Well, I hope your Cancun tickets were on Southwest, or that you can.
The airlines have been great. I think they're up against the ropes, and they're doing whatever they can from a customer service standpoint. So yeah, we were able to cancel, and we'll enjoy a nice vacation sometime later.
Good. Well, listen, anything I haven't asked that you think's important, or you'd want to share, or any parting thoughts at all?
I did have one thought over the last few days, just, kind of pertinent to emergency medicine providers. It's interesting. I think any of us who've been in medicine for a while, there are aspects of it that become routine or that become a job or, that you potentially become a little bit jaded. And I think that's, you see that in emergency medicine, you see that in other fields as well. And sometimes you have to step back and remind yourself what a privilege it is to participate in life and death and birth and telling people that they have cancer and pulling little Barbie shoes out of kids' noses. I mean, you just have to stop and say, I get to do incredible things. And having been quarantined, I feel that loss, especially during this time of pandemic where there's so much worry and emergency medicine providers are really perceived as being on the front line. I feel at a loss to not be participating in that in these days while I'm quarantined. So while lots of us would like to stay away from the hospital right now, ironically, I'm looking forward to getting back and just being on the front lines and helping people out, especially knowing that I am now hopefully not in danger of getting coronavirus again.
Yeah, well, wonderful. I wonder if removing Barbie shoes is an aerosolizing procedure, though. You may not,
I think
you may
that
not have
might
your wish
wait.
there.
I'm sorry. You're going to have to wait for a couple of weeks until this is over, and then we'll get that Barbie shoe out.
Yes. A lot of people just live with a Barbie shoe. They go back. Go back to school with the shoe in.
Right.
Well, listen, thank you so much. I very, very much appreciate it. And we may be reaching back out to you just when you're back on the front lines. If you're up for some quick updates from the ED, I'm sure that the EMM would love to put them out there.
Sounds perfect.
Thanks so much, Jared.